Welcome everyone. Good evening. Good evening to this session, which is called Health Literacy is More Topical Than Ever, Cancer Care, Health Literacy and COVID-19. And thanks to those who organised it, that's the Health Literacy Coalition, Standing Committee of European Doctors, European Patients Forum, Health Literacy Europe and MSD. And this session is funded by MSD, so thank you. And thank you to all of you who are tuning in, as it were, to this session. I know it's an evening session. Some of you had a very long day, but I can assure you this is going to be a full and rich discussion, and I'm really glad that you're joining us. It's a timely opportunity here to explore the implications of health literacy, particularly because the pandemic underlines and emphasizes its importance. And especially with the timely moment again, because there's the development of the European Beating Cancer Plan. And we want to ensure that an investment in health literacy is baked in, as it were, as a priority in the cancer care of the future. And to help us understand and discuss the issues that I've raised is a stellar panel who'll be able to set the scene for us and set out the case. And of course, we look to you as well, and I want your participation of you as delegates to contribute your expertise and to ask questions and participate. Particularly in the latter half of the session when we'll be opening up for questions. So thank you. So our speakers today, let me just introduce them all. So we have Catherine Gunter, thank you for joining us, Vice President at MSD. Christine Sorensen, founder of the Global Health Literacy Academy. Kaiser Immonen, Director of Policy, European Patients Forum. Uska Kuzier, who is a researcher at the University of Oxford. Bettina Rill, founder of the Melanoma Patient Network in Europe. Dr. Ole Johan Bakker, member of the board of the Standing Committee of European Doctors, and Matthias Schuppe, who's team leader of Cancer Plan at the European Commission, Directorate General for Health and Food Safety. So I told you it was a stellar panel, and here they are. So I know that time is going to fly by here. An hour is going to leave us very quickly. So I'm going to run quite a tight ship, particularly in the first half of the session, and there'll be time to dig down deeper and do some Q&A later. So I'm going to ask all our speakers to be succinct, and you'll forgive me if I kind of move things along, especially because we want to hear from everyone. I know everyone has very critical points to make here. So let's get going. And I'm going to start by actually getting us on a sound footing. So we're actually talking about the same thing here. So this question's to Christine. Can we agree a concise definition for health literacy in general, and then extend it specifically in the context of cancer care? And why does it matter? Well, we'll work that out as we go through, but principally, let's get a definition. Oh, Christine, you're on mute. I tell you what, while we sort that out, I'm going to ask the next question, if that's okay, just to keep things moving, and we'll come back to you, Christine. Let's look at, we will come back to the definition, but let's look at what, and this is to Catherine. What does better health literacy do for, I think there's lots of constituents here we need to consider, patients, providers, health systems sustainability, and industry as well. Is this a common goal of all of those stakeholders, or are there tensions between them? And what is that common goal?
So Vivek, thank you for the question. It's a loaded question. It's filled with hours of responses, but I will try to be concise. So I appreciate that. I mean, really, the goal is to benefit the patient at the end of the day, and health literacy is vital to cancer care. So first, taking are associated with evidence-based prevention practices, things like screening and vaccinations, early diagnosis of cancer, good adherence to a treatment plan or regimen, and the ability to address side effects that might happen as a consequence of that regimen, and ultimately better outcomes. This is especially true for our diverse populations, those more vulnerable populations that are over 65, or ethnic minorities, or people with lower literacy or numeracy skills. They're at greater risk of poor outcomes, and their health literacy is often impacted as well. So I think all of this has been exposed even more with COVID-19, because we've seen a reduction in the diagnosis rates of people because of the limited access to healthcare systems. People aren't getting less cancer, their diagnosis is being reduced because of their limited access. And so we know that when cancer care is disrupted, it has a negative impact on health consequences. So coming back to the industry, that's the second stakeholder I'll address in your question. Health literacy is very important for us at MSD. There are so many new innovations in cancer care, such as new biomarker tests and requirements for some medications. There's new combinations of therapy that are becoming more and more effective. So the complexity is increasing, and that means it's more complex for patients, more complex for healthcare providers, and also for governments. So at MSD, we work very hard to ensure that every time we have the opportunity to engage or interact with a patient, that all of our materials, our literature, our patient information, drug information is embedded with health literacy principles. Because we feel at MSD that a health outcome is really a co-creation between the patient and the healthcare professional. And so my last point is that COVID-19 has shown an extraordinary need to advance health literacy with our citizens. And I think one of the best ways to do this, and you'll hear me beating this drum, I think, over the next hour or so, is to really make sure that health literacy is a priority in our policies. In Europe's Beating Cancer Plan and also the national cancer plans, we need to have specific and explicit targets that we can establish. We need to ensure that stakeholders know that they are responsible for elevating health literacy, and create tools and dashboards to show progress in this respect. Thank you.
Thank you very much. We'll pick up that issue of prioritizing it a little later in the session. Christine, are you back with us now?
I hope so. Can you hear me?
Oh, fantastic. Okay, great.
I don't know what happened.
Thank you, nor do I, but there we go. This is
yes, indeed.
Difficulties of a virtual communication. So yes, so back to my question to you, Christine, the definition.
Yes. I was saying that 10 years ago, when I first visited Gestein, we didn't really know what health literacy was, and we've been on a journey for 10 years now, and it now is coming into mainstream. And health literacy means that if we have the knowledge and the competencies to find and understand, appraise, and apply information to take decisions in everyday life. And when we now talk about cancer literacy, this becomes really interesting and serious, because often cancer patients and their relatives are, overwhelmed with information on this new condition and this new situation. And therefore, it's really important that they are able to fully grasp what is going on, what kind of information is available, what kind of treatments should they undertake, which choices do they have, and how can they improve their health while they are on this cancer journey.
Mm-hmm. And I suppose that links very closely with what Catherine said, in that having those abilities, we know from the evidence, improves outcomes. Can I turn to you, Ole, and maybe as a clinician, can you illustrate, because clearly it's an important issue, not just in the context of the pandemic, but moving forward as we falteringly return to a normal, we hope sooner rather than later. But what difference have you seen in the real world, and I'd be open to, an anecdote even, just to kind of illustrate for us, what difference does it make when you see a patient who has a high level of health literacy? How does that impact their care in your experience?
Thank you. I'm sorry, but I didn't hear you well now. Do you want me to present the patient's story, or do you want me to answer the question?
No, just yes, a patient story. I mean, I think I'm looking for what difference does it make in the consultation room or in your experience with a patient? A real story, yes. Yes,
well, it makes a great difference, especially outside the consultation room. I mean, what is happening between the consultations, and what the story I would like to share with you is from a patient of mine. Of course, I do this in an anonymous way, but I have spoken to him, and he's aware that I present this story here. So, from a dentist born 45, he got a malignant melanoma in 2016, and the same year in autumn he had also a second cancer, a lung cancer. And he had the thoracoscopic lobectomy at the end of the year. After that, in February 19, he had the recurrence of his malignant melanoma. He had a total colitis in September the same year. He got an atrial fibrillation, and as a side effect of his treatment, he also got a myocardic aneurysm in his aortic arch in 2019, last year. And he has been given biological treatment, lifelong antibiotics, due to his aneurysm as well. He's then followed by oncologist, pulmonologist, cardiologist, vascular surgery, infectious medicine, and of course, general practitioner, and he receives home nursing. He is followed at 2 different hospitals. There is, in our country, a possibility of digital communication between general practitioner and specialists in hospital, but with the limit of the patients seen in hospital only for the last month. Digital communication between patient and GP is established, as well as between home nursing and GP. Digital communication is not established between patient and doctors in hospital, nor between patient and home nursing. This patient has digital skills, but as the digital infrastructure in the healthcare system is not open for him towards all services, he is dependent on dialogue via his general practitioner to a large extent. As all channels of dialogue are not established digitally, there are risks of delays and misunderstanding. And maybe his recurrence of malignant melanoma in February 19 could have been avoided if he had had the possibility of easy access digitally to all services at the same time. We don't know that, but it may have been. Well, this is a complex patient, complex story, but often cancer patients are just like that, and I think it's an example that could be good to see how we can develop the digital health literacy in health services and for patients.
That's it's a very stark example, Ole, and thank you. I mean, I think many of us who've had experiences with the health service, our health services have experienced similar sort of discontinuities and fragmentation. We put our trust in health services, and if we fail to follow up as patients, I think we've slipped through the net like this, and mistakes and errors happen. And so, I'm really grateful for that very clear illustration. Bettina, can I turn to you? I mean, we want to talk about this in the context of cancer care. So, cancer, I think Ole's example is illustrative of this. Cancer patients are regarded as highly vulnerable in the pandemic. Many of us had the chance to read your open letter where you pointed out that one of the issues is around information and remaining informed through the pandemic for cancer patients. So can you explain, maybe with reference to the letter for those who haven't read it, can you explain why this is a particular issue in cancer care at this time?
So thank you for that. So I am actually also in melanoma, so that's a case that is something like this is close to my heart. I built a European patient network in melanoma. By training, I am a medic, and I have worked in research in molecular biology for a couple of years. And my motivation to start this patient network was that I lost my husband to melanoma, but the treatment decisions we made at the time were largely driven by my ability to actually read and so first access and then read and understand information that was only available to professionals otherwise. And I was also not one of the nice patients, so I would never have waited for my GP to forward my email or not. So there are other ways to do that quite effectively today. And I think that's the basis of the patient network we built. So we are very interested in outcomes. So how can we help that very patient, as Ulla just said, to get the care they need? And we built this backwards. So it's a backward engineering process to support patients. And we've been doing this for a very long time now. Well, I started in December 2013. And melanoma has been a dreadful disease. It has killed people very fast. When my husband was diagnosed, it was a median survival 6 to 9 months. So we have been used to this life-threatening situation that we now see with COVID as well for a long time. So I think it is fair to say that it hasn't surprised our community as much as others who otherwise live a life where death is, we know, something that is going to happen eventually, but is not part of your daily reality, which it is for our community. We have put a lot of emphasis, and I think that's relevant for this session, into, well, I've never called it health literacy. I'm more thinking of how do I get the job done? How do I help a patient to have a better conversation with his or her medical team? And understanding the latest research is part of it. So we invest a lot of time in educating people about science and how to understand science. And that for me is a critical part of health literacy. It's not handing over a leaflet. It is more a concept of how science, how healthcare works, and how to move in that type of system. And this is something that we have seen now, and we have kind of known it. We call it knowledge protects. We know that our patients who are better educated, who understand the disease, who understand their treatment options, who understand the side effect profiles that you can expect with a certain drug, they are just doing better. They're not going to sit at home and wait. They're going to be proactive and reach out. And when you have a colitis on an immunological drug, they will insist they get care. And that's what saves lives, because not every healthcare professional is familiar with novel drugs, which I don't think we can actually expect because there are so many new ones. So what we've seen in COVID now is it was like, in a way, a flashback. We know for melanoma that knowledge protects, and in COVID, people fell for fake news, really stupid ones, that if you had a minimal understanding how to spot fake news, how to recognize what is hype, pretend, and what is real, you would have been protected. And I think that's something, a learning for us as society. We have to train our people to recognize real news, make a distinction, and maybe we can come back later on that, because something that I find quite worrisome is that we've made a big step in medicine, going from eminence-based medicine to evidence-based medicine. That is, when I was at med school, that was the big thing. That is just what they really drilled into us. If you see how we've handled the COVID situation, it felt a lot like a fall back to eminence-based time, Professor XYZ. And I don't think that that is a way to keep us safe. But maybe you can elaborate a little bit later on that and how to do this actually in a networked way.
Sure. Well, that's leading us to the next section of the conversation, I think, which is really how we improve health literacy. So I'm going to just open up a poll, if I may, that will appear in the polls tab, and we're going to leave this open as we keep talking, and then we can, I'll ask all our panelists to reflect upon the results towards the end of the session. So I'm not going to read out the poll to you in the interest of time. But please just submit your answers and we will come back to it. So moving on to this next part of the discussion, which is how we improve. We've looked at some of the gaps, but how do we improve? I just want to start, first of all, because we missed out on you, Christine, a little earlier because of the technical issues. What in Europe, what are the main issues in terms of the levels of health literacy? Is there gross inequality between parts of Europe? Is it generally high? Let's paint a picture of that so we can then target our improvements. Oh, you're on mute again, Christine. Sorry. That's it. Thank you.
Thank you. Not my mic today. In Europe, we know that health literacy is a neglected public health challenge, and more than a third of the population, and in some countries even 2/3, are facing difficulties in finding and understanding and using information to manage their health in everyday life. So we are really, challenged, and we saw it now explicitly with the COVID-19 situation, where people had to adapt to a new situation and learn and de-learn and relearn new information with the pandemic. Even these are really simple hygiene advice that we should have known anyways, and that could have prevented a lot of other diseases. We're really starting from scratch. So I think Europe has a challenge, and I appreciated the good news we had earlier on in the plenary session when our colleague from the DG Santé said that, a new health or a new European Health Union will also be a European Health Literate Union. So hopefully this can help the situation.
Oh, well, those are encouraging words. Yeah, that's fantastic. So, Kajsa, let's hear from you now. I mean, with the EPF, you represent 150 million patients across Europe. So, I mean, that gives you some authority to speak on this matter. But when we look to the future, how can health literacy improve and contribute to better patient care and patient outcomes. So we've heard this sort of individual story, which is very illustrative, but on a sort of population scale, what's the prize that we're aiming for here?
Well, thank you, Vivek, and hello, everyone. Thanks for the question. And indeed, I'm fully endorse what Bettina said from a particular patient community view. And there is this, clearly there is an understanding that patients with chronic conditions, there's an enormous potential in patients becoming more knowledgeable and more empowered through information, through being educated. But I also want to take it a little wider, because health literacy is actually a critical facet of patient empowerment for everyone. It supports the other facets, which main of which are shared decision-making and self-management. But it's also a patient's right and also a critical strategy to redress inequities in health. So because the first step of exercising your rights is knowing them and knowing how you go about exercising them. Otherwise, your rights exist only on paper. The healthcare environment, as other speakers have alluded to, is becoming much more complex. And at the same time, there is this message that people are being increasingly told to take more responsibility for their own health, particularly for prevention. And at the same time, we have this very rapidly changing information landscape, which impacts the way people actually interact with the health system through those digital tools, which are becoming more common, through online information sources. And of course, then there's social media, which is both a source of all kinds of information and a valuable networking tool for patients. So there's this paradox that at the same time as a patient, you can find too much information and not enough, or the wrong information, or even misinformation. And that's quite a hard maze to navigate through, even if you are basically highly educated. We might come back to that digital aspects later, but I just want to stress that health literacy is not about information, but good information is obviously a cornerstone of it. It's really about that space of interaction between people and healthcare providers, whether they be individuals or organizations or systems. So just to give a couple of obvious examples where health literacy can improve health outcomes. It was already mentioned about shared decision-making and the potential for self-management. Adherence is much more likely to be higher when patients both fully understand and agree and are able to commit themselves to a joint care plan. There's a very simple example, which is reading the package leaflet that comes with your medicine. Now, several studies have found that people, and particularly some older people, can find it difficult to understand. So there have been ongoing discussions to improve this and to make it more user-friendly, but that's quite a slow process. And I'm not sure how many patient safety incidents may have been prevented if people were actually able to make sense of what it says in that leaflet, which is for many the only source of information they have. But I want to give another example, and that's vaccination, because this is obviously very timely. And with so much misinformation and even anti-science conspiracy theories proliferating, I fully understand that many people get confused about whose advice they should trust. Now, public authorities are still well-trusted sources of information, but if I may say so, they are mostly not very good at communicating. And I think that's a huge missed opportunity, and it really needs to be improved. There are a lot of research studies that show that just pushing information in a sort of one-directional way is not enough, but really to get the message across requires engagement with those people that you're targeting, with those people who are hesitating and asking questions. Health literacy is clearly something that can empower patients, but also people, to sort the facts from the fiction and to understand what information they should or should not trust. So as Bettina alluded to understand how science works, how medicine works, how vaccines or the immune system works, and then make choices for themselves. So I also see it as a cornerstone of prevention and health promotion, and it should absolutely be part of any strategy to promote self-care.
Okay, thank you for that. I mean, that's again further aspects, I suppose, that of the benefits, and I think you've pointed towards some of the solutions that could be leveraged as well to improve health literacy, which we will come back to. One thing that we haven't really, what I'd like to discuss a little more in a little more depth is the effects on mental health. Both the absence of good health literacy, what that does to mental health, and what good health literacy does for mental health, particularly in the context of cancer. So Urska, your work has focused on focuses on psychological adaptation of young cancer patients, and I think you have a lot of insight into this mental health and aspect of health literacy. So perhaps you could talk to that benefit. Yeah.
We could almost say that in these unprecedented times we find ourselves in, the mental health of everybody has been somewhat impacted and perhaps compromised. And interestingly, working with young cancer patients, perhaps for the first time, they feel really understood. Bettina alluded to that earlier. They are used to dealing with uncertainty. They have self-isolated before. So on one hand, they're coping quite well. But on the other hand, we do see that there is a lot of distress. So in a recent small study where we surveyed young people, we saw that 60% reported feeling a lot more out in the pandemic times than in the times prior. And a lot of these worries and anxiety was coming from the fact that they were cancer patients with compromised immunity. They were worried about catching the virus. They were worried about not knowing how their body would react. They were worried about the reduced access to pharmacies and so on. So health literacy, really, I see it as a superpower, which is attainable to everybody. And like we discussed, it's more than just knowledge, but knowledge is the core part of it. And increasing it will reduce the burden on societies. People will lead healthier lives and the systems will be less overwhelmed, which is what happened at the beginning of the pandemic. And we know that young people, young patients are hungry for information. They really want to be included in their care. They like treatment outcomes. So they have many years ahead of them now with the improvements in treatment for cancer. So they are hungry for that information. And as we go forward with the European Beating Cancer Plan, health literacy and specifically cancer literacy needs to be included. We need to start normalizing cancer, breaking the taboos around the illness. It's so prevalent. And that will be achieved through health literacy, through educating patients as well as caregivers. And we need to be transparent in doing it. Like Kaiser said, it's a right. It's people's right. And I'll also just conclude with a brief anecdote. I've seen it firsthand, young people wondering if their long-term outcomes have been compromised due to delays in treatment for cancer. And a lot of them are even worried about not going to follow their care, not really sure what the risks and benefits are, and having adequate health literacy will help those patients lower the mental burden, the distress they're experiencing, and then follow through with their care, which is extremely important.
Okay, well, thank you for that. I'm going to, I just want to remind our delegates, the audience, to you can feel free to post questions, and we will try and pick them up in the next half of the session. So that's just a little reminder. Please do that. And I think a number of you have mentioned about prioritization. It was mentioned right at the front of our discussion. So that's a question I want to put to Matthias. I mean, I don't need to tell you that there must be competing priorities given there's a limited budget, limited resources, there are competing priorities for that, what goes into the Beating Cancer Plan and what's delivered by the plan. So I guess, how do you make the case that this is, and these things shouldn't be mutually exclusive, but sometimes they're thought of that way. So how do we make the case that this is a worthwhile investment, the health literacy in the face of access to medicines, preventative interventions, screening programs, and all these other things? Health literacy remains an important and critical priority that needs to be included and addressed in detail.
Yes, thank you and good evening. Perhaps first to stress that the mandate that my commissioner has for developing the Europe is Beating Cancer plan is a holistic one. So we are supposed to address the entire disease pathway, starting from prevention through early diagnosis, treatment, to follow-up care of cancer patients and also and survivors. And I think it's quite obvious that health literacy is a cross-cutting issue across all these domains. If we look, for instance, at prevention, we have the European Code Against Cancer that informs people, citizens, what they can do to prevent cancer. And one of the key issues that we are discussing, for instance, now in the IPAC joint action, is how to disseminate this code to the target audiences and what the best ways are to do that and to improve this dissemination. Vaccination and let's say misinformation, mistrust regarding vaccination has already been mentioned. So this is another hurdle that when we look at cancer prevention, for instance, HPV vaccination or hepatitis B vaccination is an issue that we need to address. And obviously this goes on when we talk about screening. Screening, people need to be informed that they should actually go to screening and attend if they are invited, etc. And obviously the same becomes even more important, health literacy, when you have been positively diagnosed and you go into treatment. And obviously this is also an issue that has come up now through our consultations that we had in the framework of developing the plan, but also in relation to COVID, that, for instance, cancer patients are scared to go to medical appointments because they feel unsafe, that there's an issue how this is communicated to them, that there's an issue how, let's say, the disease risk is communicated in general. For instance, with the rising infection numbers now, we hear that cancer patients or patients in general are again worried about that. And obviously also how health professionals deal with the situation has already been mentioned. Issues like telemonitoring, teleconsultations. We are lacking, for instance, guidelines, how this could be handled and how health professionals should handle this and inform patients, etc. So in that sense, it's an important issue that cuts across all the different pillars that we have for the cancer plan. And coming to let's say our mandate and how our commissioner sees that, our commissioner wants to have a plan that focuses on the citizens and the patients. She is a cancer patient and cancer survivor herself. She has experienced it herself, and she pays a lot of attention to these soft issues that go beyond inventing new treatments, etc. So in that sense, I think it's on our radar. It has also come up, as I mentioned, through our stakeholder consultations, also through the public consultation that we have been running. For instance, we discovered a relatively large variation in terms of countries where cancer patients feel sufficiently informed about their diagnosis and treatment options. And then there are a lot of countries where, let's say, the percentage of patients that feel not very well informed is also very, very large. So we have a large variation within the EU. Of course, what we have done is not representative, but I think it is well aligned with what we heard with Christine, for instance. So there is a lot to be done. And through the cancer plan, we will try to address these issues in the various pillars as they are relevant.
Thank you. I mean, what I get from that, and I mean, I don't want to put words into your mouth, but what I understand is you're saying that it's a basic and necessary part of the care infrastructure in cancer to have good health literacy across all aspects. So that's a very interesting and powerful point, if that's what you're driving at. Thank you. I want to, we've got some excellent questions, so I want to leave time for those shortly. But now I'm going to be a little unfair to our participants, to our panelists, and I'm going to ask them a really quick fire question. I want really quick, succinct answer to this from each of you. I want you to name one thing that for you would characterize or would mean that we've got good health literacy. So just one thing that you'd say, okay, that shows that health literacy is good. It can be big or small or whatever. So I'm going to, who wants to go first? Bettina, as you're
I was just
unmuted.
expecting it. Yeah. So, from my perspective, we have reached the goal that if a patient has to make a complex treatment decision and feels happy with the result and the outcome.
Catherine, you're unmuted too.
That was it. That was short.
Great, that was fantastic.
Yeah.
You're allowed to agree with someone rather than come up with something new. So yeah, Catherine, go ahead.
And I'll do the same. Matthias set the table beautifully. Health literacy is foundational from a policy standpoint and is embedded into those policies.
Great. Christine?
For me, health literacy is a system that meets the citizens where they are. So it requires, I think, a turnaround. I hope to see this in the coming years. It's very promising what Matthias Schuppe is saying regarding cancer care.
Ole?
I think there should be sufficient digital infrastructure for patients and doctors, education courses for healthcare providers and patients, eventually through patients' organizations facilitated by governments, municipalities where patients live and doctors work. I think that's important.
Great, thank you. Kajsa?
Well, I'm going to turn it round again and say that we will have a health literate system when we have a healthcare system that's intuitively easy and understandable for all its users, where people know their rights and entitlements and are able to easily access information, care, and other services they need, and everything links together seamlessly in a computer language to have a highly user-friendly interface.
Okay. And Matthias?
Well, I think the tailor-made message to the recipient, I think that's very important, because we're looking at an aging population, and also some of my relatives are getting old, and I see these problems firsthand.
Great. Okay, thank you. Okay, so now we've got that poll still running, which we'll come back to. There's a stream of questions, and I'm just going to take them in order, so to be fair to whoever's asked them. And I think the first one's really important: unequal opportunities in becoming health literate in the first place, and the socioeconomic determinants of being health literate. Now, maybe I'll aim this first at Christine, because you might have an overview on that, and then we can open it out to the floor. So, Christine, yes, that question there.
Yeah, thank you. For me, health literacy is a whole of society, or needs a whole of society approach, where children learn from early age how to take good care of themselves and knowing what their rights and duties are. You could start really, really early by teaching basic health skills, and then take it up to adolescence and adulthood and healthy aging. I do also think that it would require a redesign of educational systems in order to, for example, have a health subject in school, like we have geography and math and so on. A fundamental thing such as health and well-being would be necessary for us to really increase the awareness of health literacy throughout the life. So implementing health as a subject in schools is high on my wishing list.
Mm-hmm. Okay, which is one of the poll options, actually. So we'll see how that fares with our delegates. Anyone else want to comment on that question? Bettina, you've gone off mute, and Kajsa has as well. So I'll go, and then we'll probably move on to the next question after that. So Bettina first, thank you.
So it's actually something I've been actually thinking about a lot. So the thing is, the network we've built, we communicate in English, but we operate across language borders. So they're national conferences and national languages, which have a wider reach, just because it's national language, and speaking English like a second language at a level that you can discuss medical information requires usually already quite a considerable level of education. It excludes people, and I'm fully aware of that. However, we often have people in the public who have no kind of higher education, and my passion is trying to make science, and I'm talking about the latest developments in melanoma, accessible to everyone. And I think it's something that I would like to put on the researcher community. I think it is we as researchers are accountable towards society. We are funded by society. So I believe that making our findings, our research, our passion, what we care about accessible is part of our job. And there's so much that I've just thought about it today. So if you look at histology, that is just, you look at cells under a microscope, that is aesthetically, it's fantastic. I could just spend, there's even something that speaks to people on a very different level apart from reading papers or anything. And I don't think we use these channels often enough. So we've played with formats. So we invite a researcher. It's my session, I call the session Grill a Researcher. Of course, not officially, you understand? So it's 45 minutes. We invite a researcher. We have developed a format, which is more like a chat thing, but where you can go through quite complex systems and ideas if you just take them apart and vary the format. So I believe if the motivation is there, and you can assume that an advanced melanoma patient is motivated, and that's an important factor in this equation, you can make things accessible if you only want to. And I think it's a matter of willing and experimenting, because that's something you never get taught in your research training either. So I must say, I've been honestly surprised what you can do if you only try. So I think it's a space we have to push more for it. And I'm just not willing to buy that you can't learn it just because you haven't studied this or that. So I think that's too cheap. So it's an ambition thing for me.
Great, thank you. Kajsa?
Yeah, just wanted to add briefly, I was thinking of this in terms of various groups in society who are marginalized. And I think it's very important when it comes to health literacy to make extra efforts to reach out to those groups in a non-paternalistic way, obviously with cultural competence and working with communities and NGOs who represent those groups, to empower those who have little power and to give those people a voice. And I think it also worked in gender quite nicely. The European Men's Health Forum did some excellent work some years back with targeted health prevention messages for men. And that was a really nice example of the kind of tailored content that Matthias mentioned.
Thank you. Okay, I'm going to, I see a number of people have gone off mute. Do you want to speak on the same question, Catherine? We've got a lot of questions. Okay, go on.
Yep,
go on.
Just briefly, because we've done some work looking at vulnerable populations and making sure that when we are reaching out and communicating with those individuals, that we are actually measuring the level of comprehension that the spectrum of health literate patients have. And so we have demonstrated that it is in fact possible that MSD to put forth communications in whatever format they're in that are understandable by low health literacy individuals as well as high health literacy. Health literacy is important for every individual, regardless of their educational level, and we know that we can achieve a reasonably high comprehension, up to 97% of even low literate individuals. So I think it's a really important point, and we should continue to work on that.
Okay, thank you. So I'm trying to gather these questions together in a thread because there's so many of them, which is great. There's one issue here, I think, which is important, because I'm going to challenge even the term health literacy, because it seems to imply that the onus is on the patient and on the individual to be health literate. And that has come up as a challenge in our questions here. So is there too much emphasis on patients and not enough on the health system and on other constituencies within the health ecosystem? Yeah, go ahead, Bettina, and Ole and Matthias, if you want to comment. We haven't heard from you yet, but in the meantime, Bettina, yeah.
So I think if you work in advocacy, there is this old charity concept. So you do something for these poor, hopeless, helpless people affected by severe disease. There's a long-standing tradition. We've got centuries of that, and that's often still felt in advocacy. I think it's quite natural to come from it, especially when you're healthy. It's not quite so nice when you're then suddenly affected, because you are then suddenly at the receiving end. So when my husband was diagnosed with stage 4 melanoma from one day to the next, and one day you're in charge of your life, you believe you have it under control. Of course you don't, but it feels like it. And then the next moment, you are at the receiving end of a healthcare system. And I'm medically trained, and still I can tell you that transition, it was horror. The thing is, the moment, and we see this consistently in our network, the moment people start understanding their disease, it gives them back some control over their situation. The way they communicate with their teams change. They all of a sudden have more choices. I hate patient empowerment because it has the same concept of, I'm so nice, I hand over some power to you. I prefer agency because it's centered on the patient. It is a patient extending their reach of options. And that concept, actually, we see that people who are able to do that deal better with their situation, even if the outcome is not what we hope for. So it is not, yes, it is extra burden. And it's not nice if you say, I'm so sorry, you have a stage 4 melanoma diagnosis. And the next step is that we drag you to ESMO and teach you how to read scientific literature. That seems counterintuitive. But the people are dealing extremely well with it. So I see it more as a way to deal with a mess that life dealt you with. And I'm not so negative about assuming that responsibility. If you want power, the other side of power is responsibility. And literacy helps to assume that responsibility. And I think what Oskar said was very much in that line, that young people want to know, they want control back over their lives. So I think it is our concept about patience that needs some work. So I feel very passionate about it because I see how people change. And for me, that's success.
Oskar, did you want to comment?
Yeah, just to follow up, because I think your question was also more about different constituencies and how much of responsibility falls on the patient and how much on the others. And I think we really need to start working all together, understanding, like what Bettina is saying, we are all patients at one point or another. So we need to begin with maybe the education, the school curricula. We need to perhaps educate the medical professionals how to better communicate the scientific literature and information. We need to also provide the tools to the patients and so on. So it's a really multi-party. It's a very complex interaction of a lot of things and a lot of players for us to achieve the health literate society.
Mm-hmm. Kaiser, can I come to you in 1 second? I just want to ask Ole whether he has any comments from the healthcare professional side on what you regard as the responsibilities that healthcare professionals should shoulder in improving this.
I think for the healthcare professionals, it's very important to have a very good objective on the part of the population that do not manage to profit from all these new channels of information, of decision making, and so on. We should try to. Well, I hear that you don't like this word, Bettina, but we should try to empower them, and we should try to make them capable on many levels. I mean, not only inside the healthcare system, but also from the governments and municipalities, to give them the possibilities of learning and to profit from all the possibilities that are coming digitally and other ways in our time, especially during the COVID period. But as a key, I think that a key person for many patients in this topic is the general practitioner that should keep in close contact with all patients that get services from different parts of the healthcare system, and to give them the possibilities of decision making based on a high level of understanding of all aspects of the disease.
Mm-hmm. Thank you. I'm just going to get time check. We're 10 minutes from the end, and as ever, there's not going to be enough time to handle everything, which is good because it shows that people are very engaged. Kaiser, while you comment, because I know you wanted to comment on this as well, I just encourage everyone to look at the chat and look at the Q&A, because some of them are very much comments, very sort of pertinent comments, and and some are questions which we may not be able to handle. And some of our speakers have given answers in that chat as well in the Q&A. So please have a look at that. Also, while you speak, Kajsa, the next thing is we're going to turn to the polls and reflect on that for a couple of minutes. So Kajsa, you go ahead, and then let's all switch to the poll thing at the sidebar.
Super, thanks.
Kajsa, you want to comment? Yeah,
I'll be very brief, but I just wanted to say that I think the question is it's really an artificial opposition. There is no opposition. I think it has to be both, because you know, empowerment. Bettina, if you read our definition, you will understand that the way we define empowerment is not that you can do it to somebody. No, it comes. People can take away barriers to other people's empowerment, certainly. And so it's completely compatible with the idea that the system needs to become better, more transparent, more easily navigable, while also people can do a lot more for themselves. Yeah, so I just wanted to make that point, that there is no opposition.
Thank you. And I think that, I mean, the poll, in a way, if we look at that now, I mean, that was an unfair question. And to your point, Kajsa, we were sort of making it mutually exclusive, sort of which is going to make the biggest difference. Is it A, B, C, or D? When actually it's going to be some or all of these things which will contribute. But any reflections on what we see here? I mean, there's clearly that school curriculum has come up the highest, which has been mentioned by others. Yeah, Christine, did you want to come back on this?
Yeah, well, I wanted to come back on the concept of health literacy. We discussed a lot about the domains, let's say, of the literacy part, and less on the health part. And where I would like to see a transition as well is how do we translate health into our system thinking? We all know that the system as it is really medicalized and focusing very much on the physical or biological aspects and less on other dimensions of health. So how can we help each other to design our system and society to discuss more the positive sides of health as an asset, and also the domains of mental health, social health, emotional health, spiritual health, sexual health. And I believe all these domains are also very important for the cancer journey. And who will have this responsibility, because these are things that the patients and the families struggle with. How can they continue their lives when they have this cancer diagnosis as a bomb in their lives? And then we all focus on the really treatments and survival, where it's also about, you know, thriving and flourish even under these conditions, looking at those other domains of health.
Urska, you wanted to come in, yeah.
Yeah, I just wanted to follow up a little bit, and now we are talking generally about cancer, which is often, and for many people, a very distressing event. When a cancer diagnosis occurs, a lot of people experience mental distress. It is normal that they do. It's hard diagnosis, and I think that initial reaction is very normal. So we need to also, health literacy will help people understand that it's okay to feel anxious and perhaps down, depressed, and cope with your own way. But at the same time, it will allow people to, when they're ready, to take in the information that they need, and that information and knowledge about how much we have improved the outcomes for a lot of cancer patients. Again, I'm speaking especially for young people, that can help you regain some of that control that we were talking about, help you see the positive aspects, help you look down the line of that majority perhaps survives, and that can really, health literacy can lower that distress which is associated with cancer, and perhaps to a lesser extent with maybe some other conditions that are less severe.
Okay, thank you. Okay, let's, I'm going to give us a couple of minutes for any more comments on the poll in particular, and then we'll have to kind of begin to wrap it up then, because we're coming to the end of our time. So any thoughts on the poll? I mean, any thoughts on the idea of leveraging technology? Seems to have rated quite low in this, 11%. I guess yeah, any thoughts on that? Maybe, or maybe even from the audience, if you want to write something in the chat, we could have a look at that. Why you felt that was unimportant. And the school curriculum, I think, is interesting because, I mean, my kids have suddenly, the school has adopted, for example, teaching people about budgeting and, you know, how to manage their personal finances, which is a new thing in our school. And that's even at a young age. So that's very interesting because it's just suddenly struck me that, of course, we should be teaching people about the health system and how to navigate and how to interact. So that, I think that's quite an interesting finding there. Yeah.
Just briefly bridging a few, because it also came up on this mental stress situation. I think we have a slightly simplified idea of teaching or interaction with patients. So if you tell someone, I'm sorry, you have a stage 4 diagnosis, and then you dump a lot of information on this person in a context they've never ever heard of, even if you're a medic, you're not going to remember anything anyway, and then expect that to work. That's just naive, because we never learn anything like this. I mean, we all remember how often we had to repeat our vocabulary at school, right? I mean, repetition is the mother. So I think healthcare education, therefore, there is also the school curriculum and tech. I think we have to think of an ecosystem. So it has to have different parts. Different people learn better by different means. And I think everyone has a role to play. So a GP has a role to play, an oncologist has a role to play, school has a role to play. And it's these little bits that have to work together in order to form a fully educated person. And to repeat certain things. We have people who come on our forum, they ask the same question several times, and it takes several times to take it in. We have people who go back to their oncologist, and then you have a bit of an exchange back and forth, and it takes time. And we have to allow for that time and not be discouraged if one thing doesn't fix it, because learning doesn't work that way. So I think we should invest into understanding how learning in that particular setting works, and lifelong, because the question came for old people as well. So it has to be a lifelong. And how do we stay up to date on what's going on? So I think it's we need more of this kind of teaching expertise in this area.
Okay. So Ole, I know you want to come in here, but we're nearly out of time here, so I'm so sorry. But I want to wrap. No, there's no need to apologize. I want to wrap up though, and I want to come to this final sort of what the takeaways are. So I'm going to, again, an unfair question, and you don't all have to respond. Matthias is exempted from this question, but it's if you were to wave a magic wand and have one thing enacted and implemented from the European Beating Cancer Plan, you're only allowed one thing, what would it be? And you have a sort of 20-second window to answer that each. So I'm sorry for being unfair, but this is your opportunity to kind of leave a takeaway with all of us. So let's go. I'm going to go from the clockwise on my screen. So Catherine first.
Sure. So my one thing would be to include a definitive framework to support health literacy for patients, healthcare systems, and industries as well.
Great, thank you, Christine.
Yeah, health literacy is a political choice. So I hope that the European plan will have a sentence that encourages member states to include health literacy as part of their national cancer control plans. We know a few has that already, so that would be good.
Okay, Ole?
For me, the one and only thing that I would like to mention, if it's only one thing, it's investing in prevention. 30 to 50% of cancer deaths could be prevented by different measures.
Uska?
Yeah, I will actually second that on the prevention. Better strategies to disseminate the code, and particularly for cancer survivors to really follow the preventive measures and know how to best follow them.
Okay. Bettina?
I would like to see health move from the cost side to the asset side. Just like we think about education as an asset to our societies, I think COVID has clearly demonstrated what happens if we don't have health. I would like to see the same with cancer.
Great. Kaisa?
Well, all right. One thing, I would like the Commission to get patient organizations and other health NGOs and health literacy experts in a group together to shape a concrete health literacy action plan together as part of the cancer plan, because we have so much practical experience about the needs of our communities and we'll help to get it right. And of course, it should encompass the spectrum of health and it should be intersectoral, and it should have resources.
Great, thank you. So I can see Matthias taking copious notes there, which is great. So thank you very much for that. And that brings us to the end of our session. And look, I'd like to thank, I told you it was a stellar panel, and it has been. And I want to thank all of our delegates as well for a really interactive discussion. And I'm sorry for the questions we couldn't answer, but have a look at the chat and the Q&A. There's some excellent comments there. So thank you very much indeed, everyone. And good
Thanks,
evening.
Vivek.
Bye-bye.
Thank you.
Bye.
Bye-bye.
Bye, everyone.
Bye.
Bye.
Thank you. Bye-bye.